Earlier today, I met with a group of recovery specialists in my office and gave them a brief tour of the Capitol. They were here in honor of National Recovery Month at the state Capitol. And the steps were filled with people that are currently in recovery and families that have been impacted. There's large quilts hanging today in the Capitol Rotunda with names listed of those that have been lost to the scourge of opioid and heroin epidemic that we're seeing across our state. I've been focused on legislative initiatives with my colleagues working together in a bipartisan manner to address this issue. Last session, I introduced House Resolution 659, which created a 34-member panel to study and come back with recommendations on how we can combat this epidemic. And part of that group was encompassed from everybody from the Coroners Association to the pharmaceutical manufacturers and everybody in between, including Secretary of Drug and Alcohol Gary Tennis, the FOP, the state troopers, the state police. We also had a lot of recovery and addiction specialists that served on that board. It was a broad range of board. They held several meetings throughout the state in coming up with those recommendations. Part of those recommendations have been put into legislative action. Other recommendations have been done through the regulatory process. And with those recommendations, each issue that we've addressed legislatively, House Bill 1698 is a bill that I have championed and put forward, and that would require for parity for prescribing of abuse-deterrent opioids. As the prescription drugs have been manufactured, and one of the problems that we're seeing is you have a lot of time-released formulations in prescription drugs. So somebody could take one pill and that medicine would be broken down in their system and released over a period of a day. So instead of taking 4 pills, they're only taking 1 pill. But one of the issues that we're running into is if people are abusing those prescription drugs and using them in other forms, say if they're crushing them and ingesting them or smoking them, they get all of that powerful and very dangerous medication at one time. And because of that, we've seen many deaths, including a death of a 19-year-old individual from Carbon County. So I have championed this bill to address that. Some of the Harrisburg special interests that have been profiting on this heroin and opioid epidemic continue to block the progress, just as they did in the past when we dealt with the prescription drug monitoring program, which is now in effect. And I just got a compliment last week from an ER doctor who had said how wonderful this program is and how they're being able to identify people that are doctor shopping or abusing drugs and refer them to treatment. But that took 2 to 3 years to get that piece of legislation passed and enacted. We were 49th in the nation out of states to get that enacted. So that's why we're moving as quickly as possible to get these bills up on the schedule. We have participation and support from the House Democratic Caucus, the House Republican Caucus, and the Senate Democratic Caucus, and the Senate Republican Caucus, and the governor. We worked very closely with Secretary of Drug and Alcohol Gary Tennis, and each one of these proposals and each one of these bills addresses a specific concern. And it's from that resolution. And basically, the abuse deterrent formulation parity is a bill that I have introduced. Also, we have a legislation that will require additional educational opportunities for doctors in order to be certified to practice medicine in the state of Pennsylvania, to have training on addiction and prescribing, also for continuing education. We have a bill that will cut back on the amount of prescription drugs that are prescribed in ERs to no more than 7 days. And these have all been identified by the task force. This legislative package is supported by the FOP, the District Attorneys Association, the Recovery Specialists, DDAP. So as we move forward in this process, it's always going to be subject to people that don't particularly care for one aspect or another aspect of this legislation. But all in all, the package of all these bills together will go a long way to stemming this tide, the scourge of opioid addiction. If you look at it this way, last year we had 3,500 people in the state of Pennsylvania that died from overdoses. 80% of heroin addicts admit to having started with prescription drugs. Out of that, the people that are abusing prescription drugs, 70% of them are getting them from family members or friends, or buying them on the street. Abuse deterrent opioids have no street value at all, because people that are abusing opioids don't want them because they can't get what they need out of them. But to look at it objectively, if we had 3,500 dolphins dying and washing up on the beaches, we would be dredging the ocean to figure out what's killing the dolphins. We know what is causing this scourge. We can see it firsthand on our streets. It's in every community. It's in every socio-economic group. It doesn't discriminate, and we're losing people across society. I've talked to employers who are having a hard time to hire because people that can't pass a drug test. So the new gateway drug is prescription pain pills. That's what's leading the scourge. And as we address those issues, I would expect to sometimes be attacked. But I would just caution everybody, when you read and you see these reports, to look at it objectively. I have focused on the needs of the constituents that I serve. I have met with the families who have lost loved ones to this epidemic, and I will continue to focus and push forward with legislation that will address this issue and save lives. Abuse deterrent opioid prescription drugs are safer than non-abuse deterrent opioid prescription drugs, and lives will be saved. Why would we not want to enact this legislation? The bill passed the House almost unanimously in a bipartisan fashion, and I look forward to, over the next 3 weeks, having heard the governor today call for a joint session for the House and the Senate to move forward on a package of opioid legislation. So I would hope that within 2 weeks we're going to be able to do a report to say that we got these recommendations followed. It's been a long time in the process. These bills have been vetted in public hearings across the state over this past summer, but over the last 3 years it took to develop this package of legislation. So I look forward to getting these bills passed and making our streets a little bit safer, so hopefully we won't lose the next generation to this terrible scourge of heroin and opioid abuse.